why is it too late if we wait to menopause? Because that's what everyone's talking about, right? It's all about menopause. No, it's not all about menopause. It's all about preparing and understanding why we might have challenges at menopause. Because if we wait until menopause, which is one day, the day of a year after your last menstrual period, we've missed a lot of time. So the most bone density decreases within that first year. Your cholesterol goes up. Your risk of heart disease goes up. We have cognitive challenges, mood drops, executive function decreases. You've lost some of the ability to learn. We see the highest rates of insomnia, alcoholism, divorce, and even suicide at perimenopause. So menopause is too late. So we need to rewind and think about, are your periods getting heavier? Is your cycle slightly shorter or longer? Does it feel different compared to how it used to be? Is sex becoming painful? Because it's not just about the bleeding. Are your migraines increasing? Are you having pretty much constant headaches or every other week? Is work getting harder? Is getting to work getting harder? Are you struggling to sleep? Is sleep getting even harder before you have your period? Do you have more body pains or more injuries? Do you feel that you've got a new ACC claim every week? So these are the signs that we should be paying attention to, not waiting for hot flashes, which are often later in the perimenopause transition. If we can identify perimenopause earlier, this means fewer symptoms cause suffering. It means fewer doctor's appointments, fewer medical investigations, fewer specialist appointments, and overall better treatment. Appropriate hormone replacement therapy can make a huge difference, and even helping with menstrual bleeding. Anti-inflammatories decrease menstrual blood flow by 20 to 40%. So it's not just about hormones. Becca's heavy blood flow can cause low iron, which impacts well-being as well. The Mirena is an intrauterine device, and it's also a really safe option for most people. It reduces hysterectomy rates significantly and even lowers rates of endometrial cancer when combined with estrogen therapy as hormone replacement therapy. So the average age of menopause is 51 for Europeans, but for Asians it's 45. And the first symptoms of perimenopause are often cognitive, so brain changes, and this can happen 10 to 12 years before that. So is it appropriate to tell a 35-year-old to think about menopause? Is that out of touch? But what happens if she develops new onset insomnia and her children are now sleeping through the night? What happens if she goes back to work after maternity leave and finds it really hard? What happens if she had postnatal depression that never lifted? If she gains weight, if she starts blood pressure medications and feels off? This is probably perimenopause, or hormones are contributing. And recognizing it early can be really life-changing. It isn't just about medication, it's about choice. You shouldn't have to suffer when safe, effective options exist. And, I challenge you, have a think about how many women that you know or partners of women who have said hormone replacement therapy changed my life. You don't hear that about antidepressants or statins or blood pressure medicines or painkillers. This tells us something. It means we need to start listening and figuring out what hormones are doing so we can get appropriate hormonal management. So I'll be working and sharing my stories with some other colleagues over the next few weeks to really find out what your stories are and how we can support our community and the healthcare professionals to work as a team together.